And this morning on Today's Health, what to ask your doctor. If you're like most people, your doctor breezes in and out and you're already back home before you realize you didn't get the answers you needed. Two nurses are out with a new book to help. It's called What to Ask the Doc. Margaret Fitzpatrick is a trauma nurse specialist and Linda Burke is a surgical intensive care nurse. Good morning to both of you. Nice to have you. So what prompted you guys to write this book in the first place?
Well, Margaret and I met while working in the intensive care unit at Northwestern Memorial Hospital. While working there every day, we saw people come in that wanted information about their health care. You know, how's my dad doing today is a general question that's going to get a very non-specific response. Well, he's better today. What people want to be asking is, how long will my dad be in the ICU? What complications is he at risk for? What new medications is he on? Those are the kind of questions that people don't necessarily know they should be asking, and that's why we wrote the book, What to Ask the Doc.
Why do you think people don't ask the questions? Do you think it's because oftentimes in emergency situations they're somewhat traumatized and they're thinking about 8 million things, or are they intimidated still by doctors? What do you think is the cause of it?
All of that. It's so much, it's a foreign environment. You know, if you're not a healthcare professional, you don't know, you're not familiar with this, you feel very intimidated.
Out of your element.
You're out of your element, whether it's the emergency situation or whether you're in the paper gown in the exam room, you know, and you've just gotten a new diagnosis of high blood pressure, for instance.
And in fact, we were talking during the commercial, and you mentioned that the average doctor's visit in this day and age, particularly with managed care, is 7 minutes.
Yeah.
And you're talking soup to nuts. I said, do you mean just the conversation between the patient and the doctor? And you said, no, the whole 9 yards.
Yeah, and certainly some physicians take much more time than that, but you can't count on that. And so as a healthcare consumer, you need to be a dynamic force in this and come prepared with questions to ask.
So if you're doing a sort of a typical doctor's visit, say a physical, or you're going in for a specific health situation, you should try to write your questions down in advance, right?
Yes, absolutely, you should do that. The more prepared you are, the more information you're going to get out of that visit, and probably the more of the doctor's time.
But do you think the doctor's going to get annoyed? In other words, do you think will feel as if you're questioning his or her ability?
Well, the doctors that we've worked with don't feel that way. I mean, we see that physicians and now medical schools are really teaching that you have to learn how to answer the questions or you're not going to pass the course, you know, so it's something that is really stressed now in a lot of institutions.
It's a much more sort of proactive patient relationship, but as you mentioned to me during the commercial too, when we were chatting away, you know, there's a difference between challenging and questioning. In other words, you're not questioning the ability, you're asking questions, I guess.
Yes.
And so you have to keep that in mind too, and to keep sort of the conversation going. I know that we came up with a scenario to give an example, because this is more of an emergency situation. And we're using an example from the book, and this is what to ask the doc when your child is injured. Linda, if your child is hurt and you've reached the emergency room, what is the first set of questions you should be asking?
What you should be asking is what tests need to be done. This is a very stressful situation, and you need to know what tests will be done and why are these being done. You should also ask, can I be in the area where these tests are being done? And the answer may be no, but if you don't ask, it's definitely no.
And it is sometimes yes, but parents are too afraid. And it's something that would be comforting to both the parents and the child, certainly, if they could be present. I know sedation is another important question, especially during those specific tests that you mentioned. So what should a parent ask about sedation?
You should ask what sedation will be given. Is this absolutely necessary? And frequently it is necessary to give a child sedation to get through the test. These exams are important in getting a diagnosis. The other question you want to ask, very important, how will my child be monitored during sedation? That is the most important thing when you find out your child needs sedation.
Because you had a best friend who's, I guess, who had a near fatal situation with the child, is that right? What happened?
The child was given a sedation, IV sedation for a CAT scan, and she wasn't properly monitored and nearly had a respiratory, her breathing nearly stopped. And it was a terrifying situation for my friend. And fortunately, disaster was averted, but it could have been averted if monitoring equipment was used.
All right, so that's really, really important. Right, and Margaret, I know, continuing with our scenario, let's say you bring your child in, they decide they need tests, you get the sedation questions answered, and then it's decided that your child needs surgery.
Right.
What do you ask then?
And this is actually a situation that I'm a school nurse at Morgan Park Academy, and we've had this situation with students where parents are now faced with okay, we need to do this surgery, the first question that I would ask whenever confronted with that is this the most conservative form of treatment for this problem? Or perhaps there's another way to treat this.
I mean, is surgery too radical, in other words, right?
Is there another way that we could approach this?
A less invasive option,
absolutely.
perhaps.
Absolutely, it may be necessary. But again, if you don't ask, you won't get the answer.
And then you say, could the surgery be postponed? In other words, do you have time to evaluate other possibilities?
And become an informed consumer. Yeah. Could we maybe it is emergent and you need to do it right now. But if we can wait until tomorrow even, I can get more information and not feel like I'm making a decision in a panic.
This is another crucial question, I think. You should ask the doctor what experience he or she has performing this particular kind of surgery, because that's so important.
Absolutely.
Yes.
And you know,
oh, well, it's my first time.
Yeah.
Okay.
Yeah, I'll be seeing you.
Yeah.
Yeah. Well, you know, really, doctors in this country are so well credentialed, and they're very willing to share that information, but it may not be the first and foremost thing on their minds. So you want to know, what's your experience and what is the experience with this institution?
And could we possibly be transferred to another hospital where a surgeon might have more experience? And even with that, with anesthesia, parents should know the options as well. So they should say what kind of anesthesia is being used, for example, and are there choices for different types? Because I know that you helped your niece out, Margaret, by just encouraging her family to inquire about anesthesia, right?
Because people immediately think general anesthesia, which comes with a whole host of complications. And when the doctor was asked, is there a possibility for something less radical than general anesthesia, he said, sure,
some local
let's do
or whatever?
Yes, and he was willing to work with the mom. And you know, there's so many different people in the healthcare field that are there to help patients. There's physical therapists and pharmacists are a great resource too, and we feel so lucky to be partnering with CVS Pharmacies because they'll be carrying the book starting in mid-February.
Well, I think it has a lot of great ideas for patients, and it really does equip them to have a much sort of more fulfilling conversation with their physician.
Yeah,
so
thank you.
Margaret Fitzpatrick and Linda Burke, thank you both so much.
Thank
Appreciate it, and
very
best of luck with the book.
Thanks so much.
And if you'd like to read an excerpt, you can log onto our website or get more information about the book, today.msnbc.com. Up next, two of the average Joes sent packing from Hawaii last night. Maybe you guys want to check them out. Are you married? Okay, never mind. But first, this is Today on NBC.